Good morning. Welcome to Salina Regional's Morning Medical. Today's program, I have with me a new addition to COMCARE, Dr. Krista DeWitt. Thank you for being on the show. I wanted to start out talking a little bit about your residency and training and how that's prepared you to be a physician.
Yeah. So I originally grew up in Manhattan, Kansas, and then from there went to Emporia State for a couple years and played volleyball, and then came back to K-State to finish out my education. And after that, I took a year off and worked at the pharmaceutical plant in McPherson, which was a great experience in a different medical area. And then I went to medical school in Kansas City at Kansas City University of Medicine and Biosciences, and came back here to Salina for my residency training for the past 3 years, and I graduated just this last June.
I wanted to talk a little bit about the relationship, the patient-physician relationship. I think it's an important relationship, and sometimes we don't really think about that you have to develop something like that.
Yeah. Over time, it's important to develop trust between the patient and the physician. It does take some time, but I think that is the basis to any good relationship. Communication is important on the patient's part as well as the physician's, making sure there's clear communication, that the patient understands what we're telling them, and that we hear what the patient is trying to tell us. I'm big on educating patients, trying to make sure that they understand why we're doing something and the history behind that, rather than just telling them this is what we're going to do.
What should a patient do to number one, start that relationship? You mentioned trust,
Yeah.
but also what should they do for every appointment?
So I think it's important to make sure that the physician knows what medications the patient is taking. So every once in a while bringing in all of the medications, the bottles, the vitamins, everything that the patient is taking, to make sure that they're taking the correct doses is very important. And then also patients need to, keep track of their own medical history. What's the last date of their last colonoscopy or their mammogram? We have record of that, but it's important that they also know for their own records when they last had that done. And it's always nice when a patient comes in and says, I think I'm due for this, and you look and yes, they're due for it, so they take their health into their own hands.
Right.
So.
Okay. Thank you so much.
You're welcome.
Thanks for what you do.
Thank you.
To become a patient of Dr. DeWitt or any COMCARE physicians, please call COMCARE at 785-825-8221 and like us on Facebook and follow us on Twitter.